How does H. pylori eradication prevent stomach cancer? Imagine a tiny bacteria that can quietly live in your stomach for years, causing damage without you even knowing. That bacteria is Helicobacter pylori, or H. pylori. It is recognized by the World Health Organization as a definite cause of stomach cancer, which makes understanding how to fight it very important. Long-term infection with H. pylori is the strongest known risk factor for developing stomach cancer, especially a type called gastric adenocarcinoma. The bacteria cause ongoing inflammation in the stomach lining, leading to a condition called atrophic gastritis, where the stomach tissue becomes damaged and thinned. This damage increases the chance that normal cells will mutate and turn into cancer cells over time. When doctors successfully remove H. pylori using antibiotics, it can significantly lower the risk of stomach cancer. Large studies show that eradication can cut the risk by about half, even for those who have already had early-stage stomach cancer removed. The earlier the treatment happens, the better. This is because stopping the infection allows the stomach lining to heal and reduces inflammation. When inflammation decreases, the cells in the stomach stop multiplying as rapidly, which lowers the chance of harmful mutations forming. The way eradication helps prevent cancer involves several steps. First, removing the bacteria stops the chronic inflammation that damages the stomach lining. Second, it gives the tissue a chance to recover, which can reverse some of the early changes linked to cancer risk, like atrophic gastritis. Third, it reduces the ongoing cell turnover and DNA damage that can lead to cancer. Studies show that after successful treatment, markers of cancer risk, such as abnormal cell growth, often return to normal levels. Not all strains of H. pylori are equally dangerous. Some carry genes like CAGA and VACA that produce toxins more strongly linked to cancer development. However, even less aggressive strains can still be harmful, so eradication is generally beneficial. It is important to remember that eradication is not a guarantee. Some people may already have irreversible changes in their stomach lining, and other factors like genetics, diet, and smoking also influence cancer risk. Antibiotic resistance can make it harder to completely eliminate the bacteria in some cases. Screening for H. pylori is recommended in areas with high stomach cancer rates. If someone tests positive, treatment is usually offered. In countries with lower rates, screening might be targeted to high-risk groups, such as people from regions with high infection rates or those with a family history of stomach cancer. Regular follow-up with a healthcare provider is essential, especially if there are ongoing stomach issues or previous infection. In summary, eradicating H. pylori helps prevent stomach cancer by removing the main cause of chronic stomach inflammation. It allows the stomach lining to heal, reduces ongoing damage, and lowers the chance that harmful mutations will develop. This approach is backed by a strong body of scientific evidence and is an important part of stomach cancer prevention worldwide. However, individual risk varies, and decisions about testing and treatment should always be made with a healthcare professional to ensure the best care tailored to each person.